rehabilitation is incredibly vital for any type of a patient, especially patients suffering from a traumatic brain injury. Um, if you have to wait for the lawsuit to wend their way through the court system, I mean, what's that look like? 2, 3, 4, 7 years? You're already way behind the eight ball. Timely rehab happens within minutes of that traumatic brain injury. It's part and parcel of the diagnosis, and then everything that we're doing in the hospital is contributing to the rehabilitation potential of that patient. Once the patient becomes medically stable to start a rehab program, the earlier the better. So waiting 2, 3, 4, 7 years, your patient outcomes are going to be significantly decreased. You need to start rehab as soon as is humanly possible. Well, if our patients don't have access to the levels of care that they need to be at, there are several patients that I've worked with that had either an acute care level of rehab or home with home health care. They didn't have that middle ground of a subacute rehab, and they weren't functional enough to go to that acute care rehab and do 3 hours of therapy a day. So instead of being able to go there or go to a subacute rehab where they could start participating in rehab and get stronger to be able to go to the acute care level of rehab, we had to transfer them home with home health care. Worse, I have patients that don't even have coverage. And what happens with them is they go home and they don't rehab at all. When patients don't have access to or timely access to ongoing care, you're going to end up with less than optimal outcomes. Okay. If you've got a patient that, again, we think that they have a really good opportunity for going to acute rehab eventually. They just need someplace to go to get stronger, but they only have a choice between acute rehab and home with home health. They're not going to get that more exponentially stronger and able to go to an acute rehab if they're at home with home health care services, which come out 2 or 3 times a week. They really do need that subacute level of care. And again, there are insurance plans that don't cover that. They cover acute rehab, they cover home with home health. They're missing that middle ground. Or if they have a middle ground, it's a custodial level of care with no rehabilitation services whatsoever. So these are things that we need to think about when you're looking at, your no-fault policy. It provides for that continuity of care, that continuum of care for the patients to be able to start the rehab at the right level at that point in time, maybe graduate up to the acute care rehab level, or if they get to go to the acute care rehab level, have a step down into a subacute rehab level if they're not doing so great, give an opportunity for them to kind of build themselves back up before going back. Having options is important. I can't stress how important it is. People need to have all the options available that they possibly can in order to get the proper care. It's called right care, right setting, right time.